Hi, this is Dr. Bernard, and welcome to Before and Beyond. So, on this episode, we're just looking at pictures of teeth, and I'll be able to show you what we actually go through with a specific patient and their condition, and how we would actually treatment plan for them. So, if we look at this smile over here, this patient actually came in with a concern about wanting veneers on the teeth. But the first thing that we notice is that right at this bottom area here, you see a tooth that is what we call in crossbite. And not that it's impossible to actually put veneers, but it's unideal because if we were to lay down veneers on the bottom teeth, you would find that the top tooth right here will not be able to have a veneer in the right spot because this bottom tooth will completely obstruct that area. So what we have to plan in advance is how do we design the smile and the positions of the teeth to be ideal. And then from then on, you can actually place the veneers. So first thing is to look at the smile line. So can we see the gums of the teeth? And the answer is no. That is meaning that the upper lip is in a position where it is covering the gums of the teeth. So underneath the structure, you will see teeth that is actually about this height. Okay, pardon the bad drawing here. And so if we go back to this structure, we know for sure we can move the teeth into the ideal position. So what is the ideal position? If we look at the display of the teeth, imagine the lips to be the actual framework, right through here, but the lips and its outline will display the teeth right through, and so the teeth will be the picture. Now, if we were to build the teeth in such a symmetrical way, we also look at the philtrum, which is the top lip, and we want the midline to be pretty exact right down here. In this case, the midline is slightly to one side, but the other thing is that the side part here is quite aligned. Now, we also want this tooth to be pushed inwards and these teeth to be pushed outwards. Yeah. So the end point would be that we would want the top teeth arch to be covering the bottom teeth to some degree and no further than around this area here. Okay, so Invisalign orthodontic treatment would be ideal in this case, and he would probably need treatment for at least about 12 months so that we can fix this crossbite. And then we end up pushing all these teeth out a little bit further, so to cover the bottom teeth, and the top ones to come out, what we call to cover the buccal corridor. Buccal meaning the cheek. So we want the teeth to fill in this space, and so that you get a very, very nice symmetry to it. And then veneers would actually fill in the spaces there. Now, the advantage of putting veneers after this is that so we can also make the smile to be a little bit better in color and more even in color as well. So if we go back to this original picture, you will see that this one tooth is a little bit darker, and his main complaint also was that the bottom teeth here discolor quite quickly, and so there are defects with the smile, and then we can actually address all that with the veneers. But the most important thing, again, we go back to making sure that the patient understands we cannot do any of those veneers until we fix that crossbite. So that's it for this particular picture, and thank you for joining us on Before and Beyond.